Hi, my name is Jo, and I'm making a video about the journey that I am on because I'm currently undergoing orthognathic treatment, which is going to result in me having upper and lower jaw surgery. I've been inspired to make this video because my surgery is looming, it's just around the corner, and I've been hunting online myself for videos, trying to come across people who have recently had the surgery to try and ascertain how they have coped with their recovery. So basically, I've been inspired by what I've seen because the majority of people who have uploaded videos to YouTube, having gone through this treatment, are quite young, and obviously people recover differently. I'm not as young as some who tend to be going through the surgery, which normally happens when you're in your late teens, early 20s, and I'm a little bit older than that. So I kind of wanted to share my journey so that this helps other people who are going through the same process or are perhaps considering going through the process. So anyway, I'll try not to ramble too much, but I'll try and give you as much information as I can. I've made some notes, so I apologise if I look away a few times just to have a look at those because I don't want to miss anything out. Okay, so it's Sunday the 8th of September today, and in just under 3 weeks' time, on the 27th of September, I am going into hospital to the Derby Royal Hospital to have orthognathic surgery, upper and lower jaw surgery to you and me. I first set out on this journey quite some time ago, about 3.5 years ago, where I'd asked my dentist if I could be referred to the orthodontist. I wasn't happy with my teeth. I was getting some pain in my two front teeth here, particularly this one. It had started to move very slightly, and I didn't feel that because my bite was out of line, I had what my dentist classed as a class 3 malocclusion, which is where my bottom jaw shunts out further forward than so my bottom teeth shunted further forward than my top teeth. It's not something that had ever been addressed before. No dentist had ever said to me it's something that could be remedied, and I'd just lived with it. Through my teens, I was teased quite a bit at school, got the regular Bruce Forsyth jokes, looked like a witch. As I got a bit older, I was compared to Eddie the Eagle, who, for those who don't know, was a kind of famous for coming last in all of his ski jumps during the Winter Olympics back in the 80s. That he had a similar jaw position and was famed for it, and so the kids at school and college used to compare me to him quite a bit. And I think through my early 20s, I suffered quite a lot with low self-esteem, even probably through to recent years. And I'm 40 now, I just turned 40 a few weeks ago. I've suffered with low self-esteem and lack of confidence, and I think a lot of it does go back to those days when I was a teenager in my early 20s. And it's quite hard going to work and going to college, eventually going to work, and to overhear people talking about you, comparing you to Bruce Forsyth. And we're all adults, and a lot of the comments that I would hear were very childish, the sort of thing that you would expect to hear in a playground, not the sort of thing you would expect to hear in a workplace. And so I never talked about it. I didn't even talk about it to my parents, to my sister, who I'm very close to and share everything with, my best friends. Eventually, when I met my husband and we settled down, I never spoke to him about it. In fact, one of the things he said to me years ago, one of the things that attracted him to me was my smile. Well, I hate my smile. I've always hated my smile because of my bite. I've always been very conscious about how photographs are taken of me, the profile at which I give in a photograph. I never let anyone take a photograph of me from the side, and if I did, I got very, very upset about it if I ever saw a photograph of me from that angle. So I think I used the excuse with my dentist about my upper tooth hurting. I think I used that as an excuse to ask him to refer me to an orthodontist because adults are wearing braces a lot more nowadays. It's a lot more accepted and it's a lot more, albeit a lot of it is done privately. I wasn't expecting to be able to get my treatment on the NHS. So I went to the dentist and I told him and I said I would like to be referred to the orthodontist. And so he did, and my appointment came through, and that took about 6 months for that to come through, and I saw him. And he told me what I already knew, that I had a class 3 jaw, which gave me a malocclusion in that my teeth didn't bite together. My jaw was also slightly offset to one side, my bottom jaw, and he offered me braces treatment, but that wouldn't correct my jaw position. So he said if I wanted to go down the route of correcting my jaw position, he would refer me to a hospital, but he couldn't guarantee that I would get my treatment on the NHS. He asked me whether I would like to go to the Nottingham Queen's Medical Centre or the Derby Royal Hospital. He explained that I would probably get seen more quickly at the Nottingham Queen's Medical Centre. But he said that the department at Derby was a lot newer. It's also a teaching hospital for orthodontics. And although he didn't actually say so, I think his preference was for me to go to Derby. So he wrote off to them. I got a letter back to say that I would be listed for a an initial consultation. I had that in January 2010. That was my first consultation with the orthodontic consultant there, Anne-Marie Smith, and also with the consultant surgeon, Mr. Jones. Both very, very nice people. Both sat me down in a room with my husband. He came with me and asked me why did I want to have the surgery, and I kind of just burst into tears. And I think all the years of me holding in all my emotions and my fears and all those taunts from children at school, from overhearing conversations in the workplace, it all came tumbling out. And actually I didn't need to say anything. Mrs. Smith was very kind, very considerate, and she said straight away, we're going to list you onto our books, we're going to get you some appointments, and it's a very serious thing that you have to consider because it's a very long process. So I had to be sure that I wanted to undertake the process. They gave me a DVD which explained exactly what was involved with orthognathic treatment, asked me to go away, read that, watch that and do some reading up about it, and they made an appointment for me for 9 months later to go back when they would start me on a course of treatment. So I went back in September, I watched the video, went back for the appointment in the September and said, yes, definitely want to go ahead with it. I was very certain that I wanted to go ahead with it. My husband was less certain, but he was just very supportive of what I wanted to do. So I went back to the hospital, saw Mrs. Smith, and she said, okay, we'll get the ball rolling. I'll set you an appointment to come in, we call it a records appointment, and that was January 2011. So it's a long process. Having it done on the NHS means that you do have to wait for appointments to come through. Orthodontics are extremely busy departments, and because it's done in conjunction with orthodontics and the maxillofacial unit, you have to wait for appointments to be done together with both the consultant orthodontist and the consultant surgeon. So getting clinics, the clinics just get extremely busy. So anyway, January 2011, I went for my records appointment, a very long appointment, x-rays, photographs. They did all sorts of measurements, opening my mouth wide, seeing exactly where my jaw position was. The x-rays came back immediately and they said this is the course of treatment that we're going to put you on is that you need to have some train track braces, and they showed me moulds with braces on them to show me exactly what was involved. I would need to go back for various adjustments, and that the braces would be on between 18 months and 2 years before I get my surgery. So it was a long process, and I didn't actually get my braces fitted until September 2011, and my surgery is, as I've already said, September 2013, so it has been 2 years. I was hoping I would have had my surgery in April of this year, but when I had my meeting in April of this year with the consultant orthodontist and my consultant surgeon, who had actually been changed. I was changed from Mr. Jones. Sorry, I should have explained. I was changed from Mr. Jones to a surgeon called Mr. Dickinson, because Mr. Jones is also a cancer patient surgeon, and obviously his cancer patients take priority over routine patients, and so that you can be listed for surgery, but at the last minute the surgery date could possibly be changed because a cancer patient would take priority. And because I work and I have 2 young children, they gave it some consideration and said that I would need to be a little bit more certain as to when my surgery was going to be, so that I could plan everything in. If I was a lot younger and had less responsibility and no dependents, then it would have been different. So I was changed to Mr. Dickinson, who is an extremely nice chap. Met with him 6 months ago in a joint clinic with Mrs. Smith, my consultant orthodontist, so that he could list me for my surgery. However, he decided at that appointment that he wanted all of my wisdom teeth taken out ahead of the surgery, whereas previously Mrs. Smith had suggested that my wisdom teeth would be taken out at the time of my surgery. Anyway, he wanted them taken out ahead of my surgery and advised me that I would need 6 months to recover from that, because the bone would need to heal before they would do my main upper and lower jaw surgery. So I had my wisdom teeth taken out in February. I had another appointment in April, and now I'm having my upper and lower jaw surgery on the 27th of September. So I'm very excited. So what I want to do now is, just before I go any further, now I've explained my whole story, and again, I'm sorry if I'm rambling a little bit, but I just want to get as much information out there to you as possible so you can understand my situation, why I'm having it done. I don't know why it wasn't done when I was a teenager, when it shouldn't have been done. I think my parents are both a little bit, they can't quite understand why I'm having it done now. My dad in particular, but I wonder whether perhaps that's because he feels that it could have been addressed when I was a teenager and it wasn't. And anyway, we are where we are. So what I want to do now is just show you my bite, which looks a little bit better, I think, than it used to look, because my teeth are now a lot straighter because I've had my braces on for 2 years. But I'll show you my bite and I'll show you my side profile, and then I'll talk to you about the appointment that I had last week to get me ready for my surgery. So, side profile, side turn like that. That's me with my mouth, my back teeth biting together, which I can now do because my braces have been on. Before my braces were on, I couldn't bite my back teeth together. This is my bite now. If I look down, sorry, you can see the gap there. And I'll do the side profile this way. And with a smile. So that's my profile, and that's how it looks at the moment. When my braces first went on, they put all the train tracks all the way across. I've got 2 temporary crowns there and there. because those teeth originally were set years and years ago, from when all my big teeth came through. Those two teeth there were set quite a long way back, and so as I got older, probably in my early 20s, I had some crowns put on them to give them the appearance of being in line with my other teeth. Actually, I think I had it done for my wedding. That's right. Because I wanted to have a nice smile for my wedding. So my dentist put crowns on. Anyway, I had to have those crowns removed and temporary crowns put on while they did the brace treatment, because the adhesive that they used to glue the bracket to your teeth wouldn't stick to the porcelain of the crown, so they have to put some acrylic tempers on. Anyway, so they're on at the moment, and I've got a slight crack in that one because of the pressure. So I'm going to have those replaced when it all comes off. Anyway, so first of all, they put all the train track on, and I just had some very light wires, and then maybe every 8 weeks I went back to the orthodontist at the hospital. All my treatment's been done at the hospital. None of it's been done in an orthodontic clinic. It's all been done at the hospital in the maxillofacial and orthodontic unit. Every 8 weeks I would go back, and they would change the wire that they put in. And over time, that wire got stronger and stronger. And the purpose of it on the top was to widen my dental arch. That is your dental arch. And originally, mine was really narrow. I couldn't even sit my tongue right up into the roof of my mouth because my dental arch was so narrow, which made my top jaw very narrow, and this part of my face here was a lot narrower, which made my face appear longer and thinner. But this part of my face now has become more broad, giving what I think is a better face shape, because that has been widened. So then about 6 months ago, the strongest of wires were in, and I had hooks here and here, and I had to wear elastics that come in a little bag like this, and they're really small. These elastics here, they're tiny. Oh, dropped it, it's so tiny. But they are quite stretchy. So right at the back here, you have a hook on the bracket that goes over your molars, and I would put that on and hook it to here, and the same on this side. And I noticed really quickly that my jaw became more my bottom jaw became more central, and these teeth here in the middle became much more in line there. So they work wonders, those elastics. To start with, I just had to wear them at night to see how it went, the treatment went, and then I had to wear them during the day and at night. And then that was for about 6 months. And then this Monday, that's just gone, 6 days ago, I went for my a long appointment, which they call the measurements appointment. Which is what you have a few weeks before your surgery, and basically they take measurements of your eyes, your nose, your ears, and your jaw position. You have like this thing put on your head that goes in your ears, and they draw a pen on your face here, and they take all the measurements, and then you bite down on what looks like a wax tongue. You bite down on that like that, and it shows you right. And then they took molds of my teeth, and basically they do all of that in order to make a splint. And a splint looks like a flattened gum shield, and that is what they use during the surgery to position your teeth when they make the incisions in your jaw in order to be able to do all the movement. I know what the splint looks like because I was myself looking at a video on YouTube last night of a girl in America who's had this treatment, because I wanted to look at how she recovered, because I'm planning my recovery at the moment with taking time off work and children's responsibilities and all that kind of thing. And I hadn't actually appreciated what the splint was, because I just imagined these two pieces of wood going in my mouth. The word splint made me think of that. Anyway, it's like a flattened gum shield that goes in and you bite down on. So I had all of that done, and now I've just got to wait for an appointment on the 16th of September, so a week tomorrow, where I go and have the splint fitted. They do that a couple of weeks before the surgery just to make sure that everything fits nicely. I'll also see the model of my jaw that they will make using the measurements they took last week, because apparently that is what they have in the surgery, so that the surgeon can position the teeth on the jaw model so that he knows exactly how far he needs to push my bottom jaw back and pull my top jaw forward. That's how I understand it anyway. It might be a bit of a crude explanation, but that's the way I've understood it. So that's the 16th of September. And then on the 24th of September, the week of my surgery is on the Friday, so on the Tuesday, I'm going into the hospital, onto the ward where I will be admitted for some pre-op assessments. But I think that's really simple: blood tests, blood pressure, and then a chance to ask the nursing staff all the questions I have. There's a little bit of discrepancy at the moment between the nursing staff on the orthodontics department and what my surgeon had previously told me in the length of time that I will be in hospital. We'd kind of planned for me to be in hospital over the weekend, with maybe being discharged on the Sunday or the Monday. But when I went into the hospital last week to have all of these measurements taken, the nurse was chatting to me and asked, had I got any questions, and that was one of them. She suggested that I would have the surgery on the Friday, stay in hospital overnight Friday night, and be discharged on the Saturday. So I explained that the surgeon had previously said it would be 2, maybe 3 nights, and she said no, it will definitely be 1, possibly 2 nights. So there's a little bit of a discrepancy there. So that'll be an opportunity for me to find that out on the 24th of September when I go in for my pre-op. I think that's about it really. People keep asking me. I'm getting a lot of people asking me about my surgery now. I've always been since being listed for my surgery, I've been very open with people about talking about it. For some reason, having my braces on and knowing I'm having the surgery has, for some reason, I don't know why, given me the confidence to talk to people quite openly about why I'm having it done, how I felt when I was younger, why I felt so self-conscious of my photographs and my bite position. And I think sometimes I get a bit worried that I'm boring my friends to death. I've got a couple of really close friends who I talk to all the time about what I'm having done, and I'm sure they must be sick of hearing about it by now, but bless them, they don't say that. They listen very patiently to me. But one thing I will say is that talking about it has really, really helped me come to terms with the fact that actually in a couple of weeks' time I'm going to be going through major surgery. And my orthodontic consultant did say to me actually a few months ago that often the patient is a lot more prepared for the surgery than their family and friends are. And that's because we see other people in the clinic. Like last week I saw a girl who was 3 weeks post-op, and obviously I have nothing to compare her to because I didn't know what she looked like beforehand, but she actually looked okay. Her jaw was still wired shut. I overheard the consultant speaking to her and saying, you're still on the liquid diet, which is a little bit daunting, but hey, positive in that is that I might drop a few pounds in time to get in my little black dress at Christmas. So how am I feeling about the surgery? That's the main thing that my friends are starting to ask me that question now. Now we're getting closer, and honest answer is I'm really excited. I think my excitement has overtaken my nerves. But even now just saying that, I'm starting to get a few butterflies. So I think it is nervous excitement, but it's just excitement. I just want to get it done. It's been such a long journey. It's been 3.5 years since my first consultation in January 2010, and I just want to get it done. I'd always hoped that it would be done and dusted and I'd be recovered in time for my 40th birthday. That hasn't happened because I was 40 at the end of July. But you know, life begins at 40, that's what they say, isn't it? So that's what I'm hoping. Anyway. So I will put a video up again after I've been for my next appointment, which is when the splint is fitted. And that will be a really short video. This is going to be my longest video because obviously I've had to explain to you my backstory and what it's all about and how I'm feeling. So I'll try and post videos every time I have an appointment now, the day before my surgery, and I'll try and take some photographs and maybe try and do a quick video from my hospital bed if I can. And then